training. We're going to go over the functions of the ZOLL. And to start, we're going to do the daily user check. So you're going to do the user check anytime you've used the machine every day. And then also if this green check mark, if it's a red X, you'll want to do that. Before I get started, I want to make sure my machine is unplugged. And I already did that. So the next step is going to be to turn the machine on. It automatically opens in AED mode, so I'm going to turn it into manual mode. So it shows at 120 joules. I'm going to bring it down to 30 for the user check. I'm going to hit charge, and sometimes you have to hit it twice or you have to hit it firmly to make sure that it goes. That sound means that it was charging and now it's ready to shock. I'm going to go ahead and hit that button. It says 30 joule test okay, defib pad short. I do have my green check mark, so it's still good. I want to look in, just in case I had a red X, I can look under report data and test log, and it will highlight anything that's wrong with my machine. So if I ever have a red X, I can look and see what's wrong with my machine. It highlights, right now it says AC power not connected, which is exactly what we wanted. I told you to unplug it at the beginning, and everything else is not highlighted. It does also know the expiration date of the pads. These expire next October. And so that way, if you ever have a red X, you can look on here, see what's wrong with your machine. If it's the pads that need to be replaced, you can get those replaced quickly. We'll go ahead and stop. Okay, so we're going to go on next to pad placement, how to place the pads on the patient. You will notice on these two pads, any AED, they're going to have the pictures on it, on where the pads get placed. You don't have to memorize that. So these particular pads, one gets placed on the back and the other one on the front. The one that goes on the back is first, and there's two reasons for that. One reason is because when I turn the patient to place the back pad on, I want to place that backboard. And the second reason would be if I place the front pad first, when I turn the patient, it can arc up a little bit, the pad can, and then it causes air to get under there, and it can cause an arc and shock a rescuer or cause a fire on the patient's chest. So let's go ahead and show how to place the pads. We're going to start by turning the patient over. I'm going to place that backboard there. Remove the backing for this. I'm going underneath the scapula to the left side of the spine to make sure it's underneath that heart. We bring the patient back this way. And she would be normally doing chest compressions during this time, but just for demonstration. For the front pad, you've got your cross on here. The horizontal line is going to be lined up with the nipples, and the vertical line is going to be lined up with the sternum. So I'm going to go ahead and take the back off of here and line that up just right. And right here is where my rescuer was doing her chest compressions. Now we've got the pads placed, and let's say we're in a code. We've got the crash cart, someone's already placed the pads. We're going to go ahead and turn the machine on. It automatically opens in AED mode. And since the pads are already placed, it automatically starts analyzing. The machine is advising a shock, so I'm going to say loudly, I'm clear, you're clear, we're all clear, while doing that visual check to make sure that no one is touching the bed or the patient. Hit shock.
Perform CPR.
And now my rescuer is going to do CPR. I want to point at these numbers up here and show you about the CPR feedback. Here it shows our depth. AHA says 2 to 2.4 inches. Rate should be 100 to 120. Release is really good. And then the diamond showing up, it shows that we're doing really good compressions. So right now my rescuer is doing really good compressions. Maybe she starts to get tired though and isn't pushing quite as deep. The machine will tell us push harder and it'll highlight yellow. So I'll ask my rescuer to push a little bit harder. And the machine tells us good compressions. Otherwise, it does not talk to us. That sound you're hearing is a metronome. That's the rate, how fast we want to be going, how fast we want our rescuer to be going on their compressions.
Hey, I found somebody down. Hey, are you okay? No breathing? No response. Hey, I need some help, please.
Yes.
Hey, I'm gonna go get the, if you could do the chest compression, I'll go get the AED. The AED's here. I'm gonna turn it on.
Unit OK.
I got the pads here.
Adult pads.
When you want me to move.
Remove pad package.
Okay.
Cut or tear clothing to expose patient's bare chest. Cut or tear clothing to expose patient's bare chest. Stop CPR.
And follow
Don't
the
touch
box.
patient. Analyzing. Don't touch patient. Analyzing. Shock advised. Don't touch patient.
Clear, everybody
Press
clear?
flashing shock button. Shock
I'll do
delivered.
CPR since you did it already.
Start CPR. Push to match the tone. Push harder. Good compressions.
Have I did anything? Yes.